Hi, I'm Bill Tudor. I'm here at Dr. Gulani's office. This is a third year follow-up visit. I just happened to be in the area and decided I wanted to come by and see the doctor just as kind of a checkup, make sure everything is fine and all of the types of things. And a little bit about my story. I really enjoy technology and something new. I've been in the technology business as a designer, an inventor, and a programmer since the 1960s. I've also been the CEO of 5 successful software companies. So I have an idea of what the new innovative type of thing is and what it isn't. One of the areas that both my wife and I did is that we had radial keratotomy surgery back in 1984. And at the time, it was very successful. The problem is, 2 years later, the vision would change. As a pilot, I would get up in the air in the plane and be up there for 3 or 4 hours in the different altitude and the density. Guess what? My vision would change. Well, that took away flying, and got hurt in a ski accident because at 11,000 feet, your vision changes and you can't see. It would come back to sea level, it would come back to almost normal again. And as I was getting up in age, I couldn't pass the driver's test. And my ophthalmologist from, used to be at Baskin Palmer, went out on his own, one of their top surgeons, recommended a couple of options. One, a hard contact lens to try to deform the eye and trick it into fixing, or a surgical alternative. And that's where I came up and met Dr. Gulani and his team. Both Lou and I had both of our eyes corrected. When they were corrected, they went from 2400 at the time to, we were hoping to get 2035, 2040, and we ended up at about 2025 in each eye. I'm just very, very pleased with what happened 3 years later. It's still the same. I've known several people that have come here and done this and corrected the RK. And God, for somebody that's had RK, the way that that works with the scarring is going to deform the eye. That scarring, the fact that it's there, trying to deform it with a contact lens or other technology and implanting things isn't necessary. The type of procedure that Dr. Gulani uses, and my ophthalmologist in West Palm Beach, Florida, has recommended other people here with the same great results. In the times that we've been here, I meet people from all over the world that fly in. There was a guy from Italy, a guy from Poland, one guy from Japan that was here. The next time we came back to do the other eye, there was a person from Seattle. My wife and I were the only people from Florida that were here. People from all over the world fly in, and every one of them leaves with a successful RK procedure. And I know that this isn't common for most ophthalmologists. They're running a mill. Let me get 20 or 30 cataract patients at a time and make my money that way. But when it's something that needs to be fixed on the cornea, if you don't come and see Dr. Gulani, you're making a terrible, terrible mistake for yourself. This guy is the real deal. When you see his surgical operation that he's built here, all of the things that he's done, you've got to see this. He's there teaching all of the time to surgeons. We see other eye surgeons from around the country learning his techniques. The guy's good. He's the real deal. You've got to come and see Dr. Gulani. Thank you.